Hi Sheila.
Hi bro, how are you?
I'm great. So today for our viewers and for our monthly support group, I wanted to go over possible problems you may encounter after bariatric surgery.
Of course.
And so I was wondering if we could have a discussion about some of those problems.
Absolutely. The first and most common problem is vomiting. It is usually caused by eating food too fast and too much at one time, not chewing food well, and drinking with meals. To prevent, definitely to keep a food journal to help identify if vomiting is caused by food. Otherwise, practice mindful eating and slow down chewing. The second most common also is clogging or food blockage. This may happen when food is not chewed well and it gets stuck in the outlet between the pouch and intestines. The food will dissolve by itself, but it can be uncomfortable and also cause vomiting or gagging. And dumping syndrome, which is most commonly associated with Roux-en-Y or gastric bypass. It is intolerance to food that are high in sugar, fat, or grease. And this food enter the intestines without being partially digested. And ways to avoid, of course, is to avoid the foods that triggers it. The foods high in sugar or fat or grease.
Okay, perfect. Another point I wanted to make was I also heard that many people after surgery get into alcohol addiction. Is that true?
Yes, it's very true. This is what's called a transfer behavior or cross addiction. Alcohol is one of the items that majority of people go to. Alcohol has empty calories, which slow down weight loss, and also it leads to weight gain. It will make you drunk a lot faster after surgery, and it is best to avoid after surgery. And when it comes to transfer behavior or cross addiction, many people used to use food to satisfy their emotional needs. So when this is no longer possible after bariatric surgery, then they use other behaviors instead, such as alcohol abuse, excessive shopping, or gambling, or sexual behavior. Please do seek professional help when this becomes a problem. Another physical aspect of it that a lot of people have is constipation. It is also very common after surgery. You may consider to include more high fiber foods in the diet and increase water intake, and of course make sure that you do your exercise. Fewer bowel movement due to decreased food intake is very normal, but please call your surgeon if the problem persists. Okay. And the next thing is also gas problem. Keeping food diary will assist in eliminating possible factors such as milk or cheese, ice cream, carbonated beverages, use of straw or chewing gum. Having problem foods such as tough meat or membranes of oranges, grapefruits, skins and seeds of some fruits and vegetables, fibrous vegetables such as corn or celery, and fresh doughy breads, chicken skin, fried foods, etc. is also a common problem. Try to avoid the food items that are not tolerated. Tolerance will increase over time.
Okay, perfect. I also wanted to ask about what the psychological effects are after surgery.
Yes, there are some emotional issues that you will also go through. As your body changes so dramatically, you will also be changing emotionally as well. Some people find these changes disturbing. And obese people have sometimes used their size to hide from life, to insulate from outside world, and losing weight can make you feel vulnerable at times. If you're having trouble dealing with emotional issues, you need to find someone who you can trust to share your feelings. It may also help to seek professional counseling. This will help you go through the changes more smoothly and help you to be more successful with your weight loss. Depression is also common after bariatric surgery psychologically. For some women, estrogen, which is a hormone, is released while fat is burned to make energy. The release of estrogen may cause mood swings. And people who eat as a way to manage their emotions known as emotional eaters, may be depressed because they can no longer eat like they used to. So if you do take mood stabilizing medicine, it is important to continue taking it after surgery. Do not stop taking medicines without talking to your healthcare provider. You may need dose adjustment for your medications after surgery.
Okay, perfect. Also, what kind of reactions should someone be aware of after they have the weight loss surgery?
When it comes to relationship, there are several things that also comes after bariatric surgery. The first and foremost is partner jealousy. Your partner may have a hard time dealing with the new you. Not only that your body has changed, and emotionally you also be changing as a result of increase of self-confidence and self-esteem. And this can cause your partner to feel insecure. He or she may become possessive or even distant. If problems develop in your relationship, you may also benefit from seeking a therapist. And the second one is divorce. Change in relationship can add stress, even if the change is positive. If you are married, you should plan for added stress and how to deal with it. A therapist or counselor, again, can help you and your partner work through these changes. Friend loss. This is also a most common one. Losing a lot of weight can disrupt some friendships. You are changing every day, and you may find that your friends are unwilling or unable to change the friendship with you. And your friends may be feeling jealous of you and your success as well. And last but not least is the body image. When your body goes through such a rapid and drastic change, you tend to lose a sense of yourself. And you can actually go through an identity crisis. And you may not recognize yourself. You may feel like you're walking around in somebody else's body. And please remember that it will take some time getting used to the new you. Counseling will definitely help you during these times of uncertainty.
Awesome. Well, thank you very much for touching on all these points.
You're welcome.
Giving the viewers some advice.
You're welcome.
Thank
Hope
you,
this
Sheila.
advice helps.
Thank you.